This medication is used to help manage a certain inherited disorder called phenylketonuria, PKU, by working alongside dietary changes. It aids in removing excess phenylalanine from the body, which, if left untreated, can lead to brain damage. It is important to take this medication as prescribed by your healthcare provider and to follow a strict diet to effectively manage PKU. The recommended dosage is 100 mg soluble tablet, and it is typically taken once daily. It is best to take this medication at the same time each day to help maintain consistent levels in the body. Always consult with your doctor for personalized advice on the best timing for taking this medication. Before you start taking Sapropterin, make sure to read the patient information leaflet and instructions for use from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with a meal as directed by your doctor, usually once daily. The dosage is based on your medical condition, age, weight, lab tests, and response to treatment. You can swallow the tablets whole or dissolve them in 120 to 240 milliliters, 4 to 8 ounces, of water or apple juice. To help the tablets dissolve faster, you may stir or crush them. Drink this mixture within 15 minutes of mixing. If you see small pieces of the tablet remaining in the cup, add some more water or apple juice to the cup and drink it so you get all of the dose. You may also crush the tablets and mix them in a small amount of soft food, such as applesauce or pudding. Eat all of the mixture right away. Do not prepare a supply in advance. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Remember to tell your doctor if you do not get better or if you get worse. If you experience a runny or stuffy nose, sore throat, trouble swallowing, pain in the throat, persistent stomach/abdominal pain, unending nausea or vomiting, black stools, blood in your vomit, or signs of hyperactivity while taking this medication, be sure to notify your doctor right away. While serious side effects are rare, seek medical help immediately if you notice symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, severe dizziness or trouble breathing. Remember, this is not a complete list of possible side effects, so it's important to contact your doctor if you notice any other effects not listed. And if you're in the US, call your doctor for medical advice about side effects, or report them to the FDA. In Canada, call your doctor for medical advice, or report side effects to Health Canada. Before starting Sapropterin treatment, make sure to inform your doctor if you have any allergies or if you have a history of liver disease. If you are planning to have surgery, it's important to let your doctor know about all the medications and herbal products you are currently using. If you are pregnant, only use this medication if it is absolutely necessary, and discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so consult your doctor before breastfeeding. As for the daily dosage, the typical starting dose for adults and children over 7 years old is 10 mg per kg of body weight once a day. The dose may be adjusted by your doctor based on your specific condition. It is best to take this medication at the same time each day to maintain a consistent level in your body. Sapropterin works as a cofactor of phenylalanine hydroxylase, an enzyme that helps metabolize phenylalanine in people with phenylketonuria. By helping to break down phenylalanine, Sapropterin helps to reduce the levels of this amino acid in the blood, which is essential for managing the symptoms of phenylketonuria. This medication comes in a 100 mg soluble tablet form, which is convenient for administration. Always follow your doctor's instructions and do not adjust your dosage without consulting them first. It's important to be aware that Sapropterin 100 mg soluble tablet for phenylketonuria treatment may interact with other medications, potentially affecting how they work or increasing the risk of serious side effects. This is not an exhaustive list of possible drug interactions, so it's crucial to keep a record of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's essential to seek your doctor's approval before starting, stopping, or changing the dosage of any medications. This will help ensure the safe and effective use of Sapropterin 100 mg soluble tablet in your treatment plan. Remember, always consult with your healthcare provider before making any changes to your medication regimen. If you or someone you know has taken too much Sapropterin 100 mg soluble tablet and experienced severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It is important not to share this medication with others. It is important to have regular lab and/or medical tests, such as phenylalanine blood levels, while taking this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for the next dose, just skip the missed one. Take the next dose at your usual time. Don't take a double dose to make up for the missed one. It's important to store Sapropterin 100 mg soluble tablet at room temperature, away from light and moisture. Make sure not to store it in the bathroom, and keep it out of reach of children and pets. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so, and remember not to flush it down the toilet or pour it into a drain unless instructed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.